Hello everyone, welcome to Fayette Regional Health Talk. I'm Doug Fischesser.
And I'm Charity Moore. Thank you for joining us. Health Talk is made possible by TV3 and Fayette Regional Health System so viewers in the Whitewater Valley can get a closer look each month at specific health and wellness topics that affect each of us every day. We will feature live interviews, on-scene reports, live demonstrations, and much more.
That's right, Charity. And Fayette Regional Health Talk is also your source for up-to-date news, health news, and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. As we enter the season of giving, Fayette Regional wants to remind everyone to think of those who are less fortunate and reminded of several different ways that you can partner with organizations to help.
This year, Fayette Regional partnered with Salvation Army and collected barrels full of coats for those who are in need. If you would like to participate in the Coats for Kids annual coat drive, contact the Salvation Army at 765-825-2011. Fayette Regional once again partnered with Arba Friends and took part in the annual Operation Christmas Child by donating several toys to be packaged in shoeboxes and then distributed to underprivileged children during the Christmas season.
Indiana Department of Children's Services of Fayette County distributes toys and clothing to children who are in their program, and Fayette Regional is a proud partner. Each year, team members select a child based on gender and age and then purchase gifts for that child. If you are interested in donating for this, please contact their office at 765-825-8732. Each year, Fayette Regional works with Area 9 to cook turkeys that are used to provide meals to shut-ins throughout the area during the holiday season. Donna Falk Stearns provides the turkeys through the help of her family and friends. This is a great example of neighbors helping neighbors during the holidays.
Team members and community members alike raise their sleeve 4 times a year to give the gift of life. This year, nearly 60 units of blood was donated to the Indiana Blood Center, which helps supply over 60 hospitals in Indiana. The next opportunity to donate blood at Fayette Regional is December 3rd. Our goal for 2014 is 100 units. To get more information on donating blood, visit theindianablood.org or Fayette Regional at 765-827-8058.
Before we bring out today's guests, Fayette Regional would like to thank the community for coming and supporting a couple of our recent events. On October 17th, Fayette Regional celebrated the opening of its new Jerry Syke Behavioral Health Unit at Fayette Regional Care Pavilion. This new 8,000 square foot facility provides service to adults 55 and older who are experiencing the mental challenges that may come with aging. The senior care unit has 12 private rooms and is medically managed inpatient unit, providing 24-hour intensive coordinated therapeutic care to individuals with crisis symptom and need behavioral stabilization. We thank everyone for stopping by to celebrate this opening with us.
And finally, earlier in November, Fayette Regional held its annual free health fair in Roberts Park. A number of local agencies were on hand at Fayette County's largest health fair to educate the community in the areas of health and safety and provided a variety of free screenings. Many great door prizes and giveaways were provided. And we appreciate the support from that community and look forward to seeing everyone there again next year. And when we return, our guests will be in studio to tell us a little bit more about home health care services at Fayette Regional.
Fayette Regional is proud to welcome Dr. Amy Wynn to our Healthy Women OBGYN staff of physicians. Joining Dr. John Landry, she will be providing outstanding OBGYN services to the women of Fayette County and the Whitewater Valley. Visit their offices at 3542 Western Avenue or give them a call at 765-825-0538 to set up an appointment. Great care is right here at Fayette Regional.
Welcome back. Fayette Regional, along with the National Association for Home Care and Hospice, recently celebrated Home Care and Hospice Month. The National Association for Home Care and Hospice, which is NAHC, is a nonprofit organization that strives for excellence in all respects and represents the nation's 33,000 home care and hospice providers, along with the more than 2 million nurses, therapists, and aides. The NAHC provides these caregivers with important advocacy, education, and information. These caregivers, in turn, provide vital services to approximately 12 million Americans who are age, disabled, or ill. Joining us today is Carrie Henry, Team Leader for Fayette Regional Home Health and Hospice. Welcome to Health Talk, Carrie.
Thank you, Charity and Doug. I'm glad to be here.
Well, before we get started, could you tell us just a little bit more about yourself?
Sure, Charity. I live right here in Connersville with my husband and 3 children. We live on the family farm. I've been at Fayette Regional for over 14 years and received my bachelor's degree from Indiana University. And the story behind me coming to home health care, in my opinion, is a bit of an interesting one. During my clinicals with Indiana University, I needed to do a practicum in home health care. So I was assigned to, at that point in time, Fayette Memorial Hospital Home Health Care. And my mentor or practicum leader was Charlene Wood. After completing my education, I started my career in a skilled nursing facility and found out that there was a job opening at home health care. I interviewed for the position and accepted that position and found out that I was actually going to be replacing my mentor. And so the circle had completed and I was coming back to home health care. When I did my practicum, I found that I loved being in a patient's home and meeting them on a personal level and being able to take care of their home health care needs.
Carrie, can you explain to us what home health care is?
Sure, Doug. Home health care is a wide range of healthcare services that can be given in your home for an illness or an injury. We focus on care that can be provided that is less expensive, more convenient, and is as effective as hospital and skilled nursing facility care. The goal of home health care is to treat an illness or an injury so you can regain independence and become as self-sufficient as possible, all within the confines of your own home. We're able to provide wound care for pressure sores or surgical wound care, caregiver education, IV therapy, nutrition therapy, injections, monitoring for serious illnesses, and unstable health status, just to name a few of the services.
Good, great. Dr. Shiv Kapoor is the Medical Director for Fayette Regional Health and Hospice. Tell us a little bit more about his role.
Sure. Dr. Kapoor has been practicing in Connersville for over 19 years. He is specialized as an internal medicine physician, which is the branch of medicine that deals with diagnosis and non-surgical treatment of diseases of the internal organs, especially in adults. He currently sees patients at his practice on Virginia Avenue, and his role for home health and hospice is to serve in an advisory capacity for patient care and quality outcomes.
Are there certain requirements for receiving home health care services?
Yes, Doug. For most insurances, the patients must be under the care of a physician, and the patient should be primarily homebound. It is permissible for the patients to leave home for medical appointments and religious services. And homebound for patients is a little bit difficult for them to understand. Basically what it means is that the patient doesn't leave their home unless someone is there to assist them, or it's considerable and taxing effort for them to leave. If your family doctor is recommending home health, simply give our agency a call. Myself or one of the other staff members will actually talk with them, find out what the need is, and if we feel you're a candidate, we will talk with your family physician, or we can instruct you to contact your physician for the orders that are necessary to set up an evaluation visit. After receiving that necessary paperwork from the physician, usually we will schedule the evaluation visit within 48 hours, and that evaluation visit is at no cost to the patient or the family. And if someone's not sure if their need would qualify for home health care, just give us a call and we'll be able to talk to them over the phone and do an evaluation visit at no cost.
So, Carrie, what would a patient expect during one of these evaluation visits?
The evaluation visit will consist of a head-to-toe physical assessment, including vital signs, a visual assessment of skin, assessment of all their medications, discussion about their current and previous illnesses, and a home safety evaluation. The nurse also would evaluate for the appropriateness for home health care to make sure that the patient is indeed homebound, or to see if there is an an intense need for more therapy. And in that case, we would refer to our local rehab unit, known as ARC, or acute rehab, at our hospital.
How long would a patient expect the evaluation process to last in their home?
Well, the evaluation visit depends on the complexity of the patient and their healthcare needs, but it's approximately 1 to 2 hours. It begins with the nurse just sitting down and talking to the patient and asking them what happened to get you to this point, and what are your focus for your healthcare needs.
You mentioned some of the services earlier. Can you talk a little more about the services provided, Fayette Regional's home health?
Sure, Doug. As a skilled nurse in home health, we're able to provide vital signs monitoring, physical assessment, different types of wound care, medication instructions, diabetic education. We also work on pain control, intravenous therapy or IV therapy, catheter care, health and diet education, safety assessment of the home and surrounding environment, teaching, ostomy care, tube feeding, and many more services.
What are some of the other services besides nursing that you do focus on?
We have several different services. To speak of a few, there are 3 types of therapists. We have physical, occupational, and speech therapists. They focus primarily on assessing and retraining the patients on activities of daily living, walking, or what we call gait training, assessing the need for adaptive equipment such as walkers, canes, handbars, or different types of things that they need in their home. The easiest way to think of therapy is physical works on the lower half of the body, occupational works on the top half. We also have speech therapists, and they work on assessment and treatment of swallowing disorders. Included in our different disciplines for home health care, we also have a medical social worker, and she works with patients in their home for different needs such as medical or financial, and she's able to make referrals to other agencies or perhaps help them with securing medication from companies if they're in need. And last but most importantly, we have home health aides that provide personal care. And personal care is basically bathing care or meeting their personal needs at home.
I see. Well, what are some of the features at Fayette Regional's home health that maybe set us apart from some of the other ones in our area?
Well, Charity, we are very fortunate that we have a system that allows us to provide daily vital sign monitoring using an FDA Class II hospital-grade medical device that's installed in the patient's home. We have upgraded, and now it's wireless technology. So,
wow.
Previous to now, we weren't able to meet those needs in patients' home that didn't have a home phone or a landline phone, and now we can. It monitors daily or up to 4 times a day blood pressure, heart rate, oxygen level, temperature. It allows us to early identify trends that we might want to let the physician know about, and changes in health status. It prevents perhaps a chronic condition from worsening into something more serious and causing them to go to the hospital when it's not necessarily what they need. And in the medical world, it's called telehealth. We also, with that system, it allows us to video chat with the patient. If they have a question, perhaps they have a wound that they're not sure about, it allows us to actually pick up that monitor. It's actually a Galaxy Samsung monitor that allows us to pick it up and view that wound instead of actually traveling to the patient's home.
So, Carrie, this is definitely a good tool for identifying changes in health status. How does the patient request telehealth?
Well, generally what happens is a physician can request telehealth. Specifically, a lot of our cardiac patients, their physicians will request telehealth, but we assess every patient upon their evaluation visit for the appropriateness of telehealth.
Well, I've spent several years at Patient Financial Services, so I'm always interested in what kind of insurances our different services accept. Can you maybe describe some of those? Or?
Sure. Typically it's Medicare, but we also take any type of insurance that we're within network for. For the most part, we're pretty much in network for most all insurances that the hospital accepts. We see the typical Blue Crosses, Anthems, and then of course our primary is Medicare and Medicaid. We will call it, set it up. We'll make sure it's approved. We also have to make sure the patients are certified or authorized by the insurance companies. With Medicare, it's a little different. We don't have to do that.
Okay, well, Carrie, thank you so much for joining us today, and we are very fortunate to have such excellent home health agency services right here in our own community.
You're welcome.
Thanks again, Carrie. We'll be right back.
Fayette Regional is proud to offer the area's best heart care through their partnership with the St. Vincent's Heart Care Center. St. Vincent's is rated as Indiana's #1 cardiology group, and they are here for you in Connorsville. It's the power of 2 hospitals for your heart's health, providing quality you will not find at other area hospitals. For your health, remember great care is right here. Fayette Regional.
Welcome back. Now we have Lisa Jones in the studio with us to talk more about hospice services provided by Fayette Regional's Home Health and Hospice. Hello, Lisa. Thanks for stopping by.
Thanks for having me.
Lisa, let's start by telling us a little bit more about yourself and your role with Fayette Regional Hospice.
Well, I've lived in Franklin County for over 20 years with my 2 kids who are now in college. I've been an RN for over 15 years, starting with critical care and wound care background. It all started, my home health care career started when I was deployed by the American Red Cross to go down to Hurricane Katrina. Wow. And manage a shelter of over 700 people down there. And I learned of some people in outlying areas that were in need of care, but they couldn't get out, whether it be the roads were blocked or they didn't have transportation. So with the help of the American Red Cross, we were able to get to those people and start doing home care visits, and that's how it all started.
For those in our audience who may not know, explain what hospice is.
Well, hospice is about providing physical, emotional, and spiritual support to the terminally ill and to help the caregivers as well. It's about pain relief and assisting people to remain in the home surrounded by their loved ones during their final days.
What makes Fayette Regional Hospice Care unique?
Well, we're unique. Fayette Regional Hospice is unique in the fact that we're the only local Medicare certified hospice while providing care to Fayette, Franklin, Wayne, Union, and Rush counties. Secondly, we have over 100 years of experience in health care between all of our team members, and we're very proud of that fact. But thirdly, and most importantly, is we listen to the patient needs and the needs of the caregiver.
What are some of the things that make us unique? What are some of the other services and how are they referred to us?
Well, we take our jobs very seriously. And generally, you know, one of the first things we ask people is, you know, what are your goals? What do you want hospice to provide for you? And the majority of the time what it is they want to stay in their home. They don't want to go back to the hospital. They want to be at home. And so we work very hard. We're unique in that we work very hard to keep them at home and to help them reach that goal of having the pain relief and keeping them home with their loved one. Generally, our referrals come from physicians. However, most lately we've been getting referrals from word of mouth, which is, I think, a great compliment to all of our team members. People have heard of us or we've taken care of their family members and they want us to come back into their homes because they're comfortable with us.
Wow, I can tell that this is really a sensitive subject for you and that it's so near and dear to your heart. So we appreciate all that you do at Home Health and Hospice, and we appreciate that you came and chatted with us today on Health Talk.
Thank you very much. Thank you.
Thanks again, Lisa. We'll be right back after another commercial break.
Fayette Regional is your community hospital, serving the local area for 100 years. Founded in 1913, Fayette Regional has been providing great health care to the Whitewater Valley for a century. and giving back to the community with outreach, support, and donations, as well as employing over 600 people in the local area. Fayette Regional, your community hospital.
Welcome back. Doug, can you tell us a little bit about what's going on in the foundation these days?
Well, Charity, we've been pretty busy with the rollout and the launch of our annual appeal this past month. The 2013 appeal runs 3 months through the end of December. We moved it back about a month this year to give our donors an opportunity to take a tax deduction in the year 2013.
Well, can you give us a little insight about how the appeal benefits the hospital?
Well, the Foundation's major objectives is to reach out to individuals, corporations, and organizations, other foundations, and also we research and apply for various state and government grants. The appeal is obviously a big part of the whole fundraising process. Our objectives with the appeal are, first of all, is to inform the public on what's happening at the hospital and what we need for support. Secondly, it gives our donors a way to establish a giving habit for our donors. It gives them an avenue to participate and start a habit of giving. Thirdly, renews donors' giving opportunities. If donors have not given lately, it gives them a chance to start again. And fourth, basis for planned giving. It's a great basis for planned giving. As donors get older, they may want to put the hospital in their wills and estates. And also, obviously, we want to develop and expand our donor base, more donors, more support. And lastly, obviously, we want to raise money for the support of the parts of the hospital.
Who do you actually focus on when you're putting together this your appeal for your mailing list?
The focus on the appeal mailing is, first of all, to the community and the surrounding counties that we serve. Mm-hmm. Team members at the hospital. We have a lot of team members that give to the appeal. Mainly, even if it's just $10, $20, $25, obviously every little bit helps. Our volunteers, we reach out to them. They've been volunteering at the hospital since the mid-50s, and obviously they put a lot of time and effort into what we do every day, and they've been very supportive in the third floor renovation, the ER renovation, those types of things. So they have been very supportive in what they do for us. The business community, we're part of the business community, obviously. And we hope that they will help and in turn reciprocate with their support. Also, suppliers and vendors of the hospital. We buy probably, obviously, millions of dollars a year. Mm-hmm. And these suppliers, we hope that our suppliers and vendors will hopefully give back to what we do at the hospital. And also grateful patients. We have a lot of patients that may have gotten great care in the Heart Care Center, Women's Center, hospice, those types of things. And we hope that a great experience will spur a donor to support that particular department where they receive great care.
Okay, so you mentioned some of the departments that, the appeal has actually helped. Can you maybe expand upon that, some of the projects? Or
monies donated to the fund can be directed to by the donors to 16 different areas. Just to name a few, I've mentioned the Heart Care Center, Cancer Care Center, Women's Center, and the Hospice Program, which I said has been probably the most popular over the years. The last 4 years, we've been involved with both the third floor renovation and the ER renovation. So the appeal has been very instrumental in their successful completion also. Lastly, I want to mention that all donations of $100 or more are recognized as members of the 1913 Founders Circle. And anyone needing any more information can call me at the office at the Foundation. That's 827-7798. Well, that's about all we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Doug Fischesser.
And I'm Charity Moore.
Stay healthy, Connersville, and if you're not, stop by and see us.